We got a couple survivors right now in the news, and Dr. John Wyckoff is here from the Wyckoff Wellness Center in East Lansing, but people come from around the state to come and see you for their health matters, and you're a unique way of sort of inspiring them and showing them how they can get back on the right path. Let me ask you first, George Herbert Walker Bush went into the hospital with bronchitis right around Thanksgiving. Last I heard, he's still there. And he's been improving, and then he had a fever and went into ICU, and now back in he's 88 years old or something like that. Yes. And he has also Parkinson's, I think, doesn't he? Why would someone have to stay in the hospital for more than a month with bronchitis?
Well, I think bronchitis is probably the simple term. He probably has had a complicated course due to his age and the fact that his organ systems are they're old. His kidney function, his liver function, his brain function is somewhat deteriorated due to age. And I would imagine that he's either had a difficult virus or he's had a bacteria that's resistant to antibiotics. And people, when they're in their 80s, they respond slower. He's a little more fragile and frail. So it's not too terribly unusual, maybe more complicated than typically you would think even at that age, but certainly within the realm of what you would see in someone who is 88 who has some other medical issues.
When you're in the hospital for more than a month like that, do you typically emerge, or is it too broad a question?
You know, it really depends on a lot of variables. He may go to a step-down unit for a period of time, kind of a rehab unit, because, you know, what I always told patients is for every day you were in bed, it took 3 days to get back to normal.
That's what I wondered
about.
about.
If you're in there 6 weeks, we're talking, maybe, several months to really regain where you were before the initial hospitalization.
That's what I suspect. I don't know anything about it, but it just seems to me like the longer you're in there, the tougher it is to get back to normal.
No doubt about it.
Hilary Clinton now. She is apparently going to testify, even though she fell, hit her head, had a concussion, and now a blood clot. Well, what do you think about her? I mean, she's the number one pick right now to run for president in 4 years, even at her age.
Well, she had a condition that's not terribly uncommon where there's hemorrhaging or blood gets away from a blood vessel between the space between the skull and the lining of the brain. It's called the epidural space. And for our listeners who've had, like a baby, they may have had an epidural anesthetic. Well, that's the same space down low in the back. This is the same space in the brain. There's not bleeding into the brain, so there wasn't a stroke or there wasn't a brain injury. But when that blood got out of the vein, it formed a clot. A little different than the clot like you would get in your leg. You think like a deep venous thrombosis. That's a blood clot, but that's inside the vein. This blood clot was outside of the vein. It was blood that actually left the blood vessel and accumulated in a potential space. Now, that blood typically will just reabsorb with maybe some blood thinners and some time. Usually that blood will just get reabsorbed back into the circulation just like any other blood clot would. Sometimes it can be real severe, and they have to go and actually drill a small hole in the skull and remove the clot. But in her case, it was not that severe, and I expect she'll make a full recovery, and she'll have no deficit or problems whatsoever.